Hello friends, today we are going to discuss about how to read or how to interpret a full blood count report. This test, also called as complete blood count, a common blood test for use in measures various components of blood. No specific preparation for this test and it can be done at any times of the day. This test also used for screening, diagnosis and monitor variety of conditions. This blood sample collected in purple top tube. Similar name for this tube, lavender tube, which contains ethylene diamine tetraacetic acid. Short form EDTA. EDTA is anticoagulant that prevents blood from clotting by binding calcium. The required blood volume is usually 2 milliliters of the blood. Blood is mainly divided to two parts. Blood plasma and blood cells. There are three types of the main blood cells. There are three main types of the blood cells. First one is WBC, white blood cells. Second one is RBC, red blood cells. Third one is platelets. Additionally, following values are present in FBC reports: hemoglobin, hematocrit, MCV, mean corpuscular volume, MCH, mean corpuscular hemoglobin, MCHC, mean corpuscular hemoglobin concentration. The blood cells are produced in the bone marrows in the bone. Full blood count report is used to analyze these components. Full blood count report is used to analyze these components. In disease condition, this number of cells can be abnormal high or abnormal low. This may slightly vary depending on the laboratory conditions test. White blood cells or WBC are also called as lymphocytes. They help to fight against infection. There are 5 main types of WBC: basophil, eosinophil, lymphocytes, monocytes and neutrophils. Generally, in case of viral infection, increased number of lymphocytes. In case of bacterial infection, increased number of neutrophils. In parasite infection, increased number of eosinophils. In thyroid problem, increased number of basophils. In allergic reaction, increase basophil and eosinophil count. WBC normal range 4000 to 11,000 cells per microliter. Causes for decreased WBC count. Bone marrow failure. A condition that aplastic anemia, chemotherapy, radiotherapy, failure to produce enough WBC cells. Lymphoma. Enlarged spleen. Spleen destroy cells more than usual. Some viral or severe infection. RBC, red blood cells, normal range. RBC normal range in male 4.7 to 6.1 million cells per microliter. Females 4.2 to 5.2 million cells per microliter. Causes for increased RBC count. Dehydration, heart failure, COPD, renal cell carcinoma, pulmonary fibrosis. Causes for decreased RBC count. Anemia, creatine medication, example as chemotherapy. Chronic kidney diseases, heavy menstrual bleeding, and liver cirrhosis. Hemoglobin, normal range, normal level 13 to 17. Causes for increased hemoglobin level. Example, dehydration, relative polycythemia, excess hormone production. Causes for decreased hemoglobin level. Blood loss, nutritional deficiencies, chronic diseases like cancer, liver disease, kidney disease, bone marrow disease or disorders. Example, multiple myeloma, genetic blood disorders like thalassemia, platelet. Platelet, normal range 150 to 450,000 cells per microliter. Causes for high platelet. Inflammation or infection. Iron deficiency anemia. Blood loss. Essential thrombocytopenia. Cancer. Forced splenectomy. Polycythemia. Chronic myeloid leukemia. Causes of low platelet. Platelet disorders. Leukemia, anemia, liver disease, toxin exposed, alcohol. Next on it, SCT, hematocrit count, also called as factored cell volume, measures percentage of red blood cells in the blood. Causes of high SCT level. Dehydration, Polycythemia increase RBC production. Chronic hypoxia. Causes of low HCT level. Blood loss, anemia, overhydration. Mean corpuscular volume. Measures size of red blood cells. Causes of high MCV level. Vitamin B12 deficiency. Liver disease. Cytotoxic drug. Myelodysplasia. Causes of low MCV, iron deficiency, chronic blood loss, thalassemia, and lead toxicity. MCH measure the average amount of hemoglobin in the red blood cells. MCHC MCHC average concentration of hemoglobin in the red blood cells. Today our program is over. Like, comment and subscribe our YouTube channel. Give your ideas at comment section.